Hi there, Deepa again. If you are tuning in directly into this video, I highly recommend you watch my earlier videos where I had covered a lot about my journey into the breast cancer and how I chose the step of mastectomy and DIEP for reconstruction. Now, in this episode, I want to talk more details about the DIEP surgery, my experience, and some audios, and what are some things I bought that helped me, manage post my discharge from hospital and during my recovery. For clarification, I'm 15 days today post my surgery. Um, so DIEP surgery is one of the most complicated surgery. It involves two plastic surgeons, one oncosurgeon. The oncosurgeon performs the mastectomy part. The plastic surgeons perform removing the abdominal tissue and construct the breast part. And getting a date for the surgery itself could be challenging because now you have the schedule of three surgeons plus operation theater, in the hospital. So I had to wait, more than 2 full months for my surgery date, which was also a lot of, anxiety. When you're waiting, the more time that you have, that more time, it makes you sort of anxious and worry about things to come. But on the positive side, it did allow me time to prepare my body and mind to face the surgery. Leading into, I have been very mindful with my eating habits for the past 2 years, like very strict sort of, like what I mean that in general I have led a very healthy lifestyle, but the past 2 years I have bought kitchen scale, where I weigh my food. It's not even an approximation. If I track my macros, like consumption of protein, carb, and fats. I measure everything that I eat, unless it comes from a pack, and which I try to reduce, less processed food, right? So, and in terms of workout regime, also I've been pretty strict, and I've been for the last 2 years following a very balanced workout, like 3 times a week of strength training and mixed with cardio, like HIIT, and core workouts and some yoga, along with at least 4 miles of walk every day. 4 miles. My workout is in addition to 4 mile walk. So, but for specifically for the DIEP surgery, I asked my plastic surgeon, "Hey, what kind of workout? Do you want me to focus more on whatnot?" He asked me to do more sit-ups. So, given the core area is where the abdominal area is going to be, going through the surgery and recovery, long incision and whatnot. So I was paying more attention to my core workout and um, my flexibility of the body and everything. Also, I consulted a oncodietitian who advised me to increase my protein. I basically shared, my calorie goal, daily calorie goal with them, and how much of that I take. So, for example, I try to hit about 1,300 to 1,400 calories a day, and of which at least 80 to 90 grams protein and 130 grams to 40 grams of carbs and 40 grams of fat. So that's usually my breakdown. And so my dietitian advised that I increase my protein some more, like 20 grams or some more. Similarly, post surgery also I should focus more on my protein intake. It helps with faster recovery and healing. So the 2 months that I had to wait, I went in preparation of this. So physically, this was a preparation. Mentally, for a long time, even before any of this, I've been wanting to do meditation to manage stress and emotional health. So that is something I took it as made it as a habit during this time. And I started small but consistent. Consistency is the key. Every day I started meditating for 5 minutes for a week, then I increased to 10 minutes, like such. Now I'm doing 20 minutes a day. If you do the same time each day, it's much effective. But even if that's not the case, that's fine. As long as you do, that matters. Now, along with this, I also started, as I shared earlier in another video, I didn't know anybody in my social circle, like a person gone through this directly. Actually, I found one person I remembered, my dentist from the past. She has now, retired, but I reached out and had a conversation. That immensely helped. Talking to somebody who has gone this, they know what the right questions to ask, the right words to say. Because I found that after this diagnosis, when I share this information to your friends and known circle, different people act differently, and they don't know sometimes how to react, and that is normal. And they may say things to be helpful, but which was not helpful sometime in some circumstances. So um, but talking to somebody that has gone through this really helped. It gives you confidence that you can do this, I can go through this, and be able to discuss some options and whatnot. So definitely. And also, in addition to that, I joined some Facebook groups on this, so connected with various women that that are part of the group, that share their experiences, questions, and various information. Sometimes it is overwhelming. If I feel like I'm getting anxious or overwhelmed by that, then I'll take a break from that, looking at that information in the group. But whenever feel confident and ready to face this, I would read more and understand. That gave me a lot of strength to come out with a plan. How am I going to face this surgery, right? So in terms of things needed, um, one thing a lot of people recommended that I bought and currently I'm taking is a drink called Juven, Juven. I bought it on Amazon. It's a flavored, it comes in various flavors. It's a flavored packet. You just mix it in water, and it has, I believe, collagen too, and it helps with wound healing, faster healing. I take it daily. And my protein, as my dietitian suggested, my protein intake, I pay attention to this every day. I used to eat a lot of salad. My dietitian said post surgery, don't consume raw salad, raw vegetables, because it's hard fiber that body needs to process. So instead, she suggested I can saute it or steam it, but avoid raw salad. So I'm following all that. So Juven is one thing I bought. So another thing I needed is, I did know that post surgery I will come home with drains, from my body. There could be a couple from my breast, couple from my abdomen area. These drains are basically there to collect the liquid that segregates as part of our body healing. If the drains are not there, these liquids are in your body, that needs to be either aspirated by the doctor with a syringe, or it's not good, right? So it is a reality that the drains would be in the hospital itself, but some people might have more liquid segregation, some people may have less. So it is very likely people go home with some of the drains still intact. I had three when I came home. Now, when you have drains, so the end of the drain has a sort of a bulb, sort of a plastic thing. That's where the liquid collects. So you can't just let it hang, right? Because it is sewn into your body. It is stitched into our body. So it'd be painful if we cannot let it hang. But we do need to wear clothes that are sort of normal. So this shirt that I'm wearing, this is one of the mastectomy shirt. It has pockets inside, and this is like full zip opening. So it is hard to lift the arm. And if you have both DMX, double mastectomy, both arms are hard to lift. So This kind of shirt doesn't require lifting the arm completely. You can wear it easily. It can be zipped up easily, and it has pockets inside to keep the drains. Um, I invested in this one shirt, and there is one more sort of top, sleeveless top with pockets. I invested so I can wear any sort of jacket on top of it. Nothing much. I got just two of them. And Another thing is post surgery, you have to be like at least 45 degrees sort of elevation. One cannot lie flat or sleep flat. You have to be elevated about 45 degrees. So a lot of people recommended recliner. I had a recliner at home. I said probably I will use that. I also have a bed that can be reclined, with the power. You can incline your feet, incline your head area, whatnot. I had both options, so I thought I would decide post my surgery which one to use, but I made both the setup ready just in case. I did buy a mastectomy pillow, which is sort of a huggable pillow, but I did not end up using it. I didn't find that was necessary for me, so I returned it. A lot of people recommended like a squatty potty, like so that we don't stretch our. The one thing that we should not do is put any pressure in the abdominal area, stretch it, or push it. You can't squat, or you can't bend your knee, or bend forward. A very less pressure or anything to your abdominal area is the key. So that was recommended. Again, I found that for me personally, I didn't need, so I returned it as well. So far the things I used were the two tops, mastectomy tops, and the Juven ring. Um, every surgeon is different. Some surgeons say that even in the hospital post surgery, abdominal breast binder to be used. By my surgeon did not want to use any binder. He wanted it to be sort of free, not compressed. But then it was uncomfortable for me. So after post 4 days of surgery, when I was ready to be discharged, I needed some support. So I asked my surgeon. Then he suggested, okay, I can wear a surgical bra. Surgical bras are different than compression bras. So again, I found this in Amazon. They have zips in front, easy to wear. I found them immensely, supportive and useful, and I felt comfortable wearing them. So that is a good investment as well. Not expensive. And The one thing that you also need is something called lanyard. Lanyard, again, it is available in Amazon. It's like a belt that goes around your hips, and it has pockets for your drains, because when you want to take shower, you need some place to put the drains, right? So these lanyards will be the holder for them. So I bought that. That was a good investment. And when I showered, I put my drains in them, and I take shower, and then once I wear my clothes with the pockets, then I can put the drains back in them. Pretty much that's it in terms of any needs. Anything else is, I didn't need it. A lot of people, I mean, I may buy further like silicone scar tape or whatever for healing, but I'm not there yet. So I'll share in the future if I end up buying something. But so far, that's all I needed. I do wear something called abdominal binder, but they provide you those are binders in the hospital when you go home. So no need to buy them. I am supposed to wear these binders for at least 6 weeks, 24/7. It is an inconvenient. It is like somebody constantly constricting you all the time, and so it's inconvenient when I'm sleeping, but it's a necessity. So I'm wearing them even as we speak right now. All right, let's talk about the surgery itself. So the day prior to the DIEP surgery, I had to go in for getting a nuclear medication injection in my breast. This injection basically it injects a dye into the breast, and because the breasts are connected, each breast is connected to various lymph nodes. Now, the doctors want to identify the sentinel lymph node, which is basically the primary lymph node or nodes that the breast, immediately, transmits. So, if cancer were to spread, those lymph nodes would be the ones that get affected. So, the during the mastectomy, lymph node is also removed. Not all of them, the sentinel ones. One or two, the surgeon makes a decision on the table, like in the room. Basically, for me, they only ended up removing one lymph node, and that is also sent for pathology post surgery to test for any presence of cancer or not. Because it is also a possibility, because the time elapses between all this diagnosis and tests and surgery and surgical date. Sometimes people get upgraded from being, stage 0 to stage 1, which is a bit invasive, or because it's now presence in their lymph node or whatever. So that is another scary part. So anyway, that injection, they don't give any numbing cream or medicine, so it was pretty painful for me. It did sting for what felt like few minutes, and after that it subsided. And this is done just prior to the previous day of the surgery. And on the day of surgery, we had to go pretty early, like 5 o'clock in the morning. And after I go in, you have to first clean your whole body, including mouth. No drinking, or drinking as in like not even water. Prior to since 12 o'clock the previous day, no food, no water, because it interacts with anesthetic, the process. You don't want to have any water that comes and reflects, right? So strictly no water, and no food after 12 p.m. of the previous night. Of course, drinking of alcohol, don't even do it prior to surgery. At least few weeks prior, have your last drink or whatever, because it does, it comes in the way of healing and whatnot. So on the day of, so even you're brushing teeth, you can't spit, use water. That was not a good feeling. But anyways, all those cleaning and getting ready, into the, and I no jewelry is permitted, so remove everything before even you go to the hospital. It's much better that way. And no cream or moisturizer or perfume, in your underarms or body surgical area. And once it was done, all your surgeons will visit and talk to you in where you are, before. And this time I requested my anesthesia, because I was so anxious, and I was nearly in tears, or in tears, rather. Then anesthesia said they will give me an injection even before I'm taken to the OR. So that was immensely helpful for me. One thing that really touched me was when my oncosurgeon visited me, and I was in tears, and I was not even sure, what. There are various things go through your mind, whether the fear of coming back, or going through the surgery, the cancer, losing a breast, which is permanently you're gonna, because one thing about reconstruction is reconstruction may give the feeling that you have a breast, but you lose all the touch feeling, right? There's, because your nerves are also taken. This is not a, at least I didn't have a nerve sparring surgery, so there's no feeling of touch. I only knew what to expect. Like people said, people generally feel some pressure. That's all. I mean, I don't know what that means, right? So that was the hardest part. I didn't even know why I was, in tears at the time. But my oncosurgeon said that, hey, this breast has given you a lot of headache this whole year. Let's remove it. And when she said that, I was like really, it was immensely helpful for me, because now I was able to turn around that and see that in a positive light. Okay, something has been bothering me, and it is going to go out of my body, right? So the frame of my mind kind of changed. I'm really thankful for her. And then I said goodbye to my husband, and then went and and along the way, I went into unconscious state to the OR. So I didn't know, and again I woke up in ICU. I think that was very hard for my husband, who was waiting for 8 hours to understand what happened. And I think the first thing that hits you after you wake up in recovery is that due to the fact that the intubation was done and your mouth was open, it is so dry, and even your voice is sort of strained, and you lose your voice sort of. And all I needed was ice cube. That's all. I was not hungry. I didn't need anything. I couldn't even drink, but just ice cube. So my husband was feeding ice cube one at a time. I don't even know how many cups of them, but that immensely helped. The right next day, sort of feeling better in my throat, and my voice was a bit normal. I could feel like I can talk, say things. So ice cube was immensely helpful. And the first night was totally a blur because I was still under the effects of the medication. The pain medication also, they give a very high dosage of sort of codeine medications, narcotic type. So the first night was a blur. You are mostly tied to all these machines. Like there was a BP monitor that was tied to my right hand. It was periodically squeezing and measuring my pressure. I had a compression socks on that was sort of massaging periodically, so I don't get blood clots. That was one of the serious side effects of this one. And because I'm also not moving or getting down, in the first day I did not get down from my bed at all. I had a catheter on and IV in both the hands, so for pain medication and antibiotic and whatnot. So that was my first night. I didn't eat anything that day. The second day, I had breakfast slowly, and but due to the pain medication, all my body signals were pretty slow. They removed the catheter. I was told that I should probably use the restroom, get down from the bed. But obviously, I needed a lot of help, and getting down from the bed, getting up to the back of the bed was very painful in my abdomen area. Like first day I could only put one of my feet. The other feet I needed help, the nurse to put it back. It was hard. Scooting was not possible. Somebody had to move me. That was my day 2. Day 3 was a little bit better. I realized that narcotic drugs are like making it worse for me in terms of bowel movements and whatnot. So I requested them to stop, but I was given a very high dosage of Tylenol instead, and lot of laxative. I felt like I was eating more laxative than food on my day 2. This is one thing that I was not prepared for, bowel movement. Even in the groups that I was there and discussed, nobody said that it would be hard. It was very hard. Because I have taken so much laxatives and softeners, stool softeners like Miralax, Colace, you name it, I had it. I naturally got the urge finally to go, but it was hard because I felt like the pressure was coming in my stomach and it was hurting a lot. And I was not sure whether I'm gonna, affect my stitches, and if the pressure is too hard and whatnot. The nurses in the hospital were really, really helpful. They were very friendly. Finally, that this nurse helped me the most, and I had my first bowel movement. Then from then onwards, I was very careful in taking whatever I'm eating. It made it like fibrous food. Ensure I'm having prune juice and having Miralax and whatnot until it became like sort of normal. I didn't want to go through the ordeal of the first bowel movement. So be prepared. I think this was like, people said that this would happen, but I didn't know the extent of it, how bad it could be. Like that was it. It felt like a childbirth for me, super bad. Could you do anything about it differently to avoid that? I don't know. Maybe even prior days to surgery, maybe we should have like more fibrous food or whatever. But anyway, I did ask my surgeon, and I think they focus more on the body getting good nutrition and um, energy rather than this. So I was told to eat whatever I want. Anyway, most of my diet consisted of like chia seed, Greek yogurt, and all those gut-friendly foods. In spite of it, my, yeah, and it could be everybody's individual body, right? It's not. I wouldn't say that it will happen to everybody, but anyways, something to watch out for. Um, but I do want to say every day got a little bit better. On day, so after the 2 days, so as I said, every 1 hour the nurse comes and checks your probes for monitoring the whether the breast flap is getting the blood flow and the artery is working as expected and whatnot. So I didn't have any complications for the first 3 days. That was great. My plastic surgeon was visiting me every day. I had some liquid accumulation in my breast. He was aspirating it. But apart from that, no other complications. So then I was ready to be moved to the regular ward where the checks now would become like every 4 hours. Um, I was encouraged to walk this day. So far I had just been getting down and walking to the restroom in the room. So now after the from day 3 onwards, I was encouraged to walk in the hospital corridor. Um, in I had already read that a lot of people hunch, go forward because the stomach, you know, tissues are pulled and stitched together. That's a natural tendency. So, but I was able to walk. It was very uncomfortable. You can't even tell whether it is uncomfortable that arises because they pulled and stitched like that. Is it due to the incision wounds, or is it due to the abdominal binder you are wearing on? God knows what it was. It was very uncomfortable. I walked just 20 yards the third day and I was exhausted. That was another thing. Like this surgery, there is, you have blood loss and a lot of those things. It makes you so weak. Day one, I couldn't even lift my smartphone. If somebody were to, reach out, but whatnot. I couldn't. I didn't even lift it. I felt so weak, but it improved. On day three, I took 20 steps, but it was hard. I felt exhausted and came back, and I was in tears because I was walking 4 mile a day, and I was like, when will I get back to that? Like the path ahead of me felt very overwhelming for me. Um so, but I just trusted the process and went ahead, and took solace in the fact that so far I had not gotten into any complications, with respect to the flap surviving or anything like that. So, day four, uh, yeah, day four. Then I was discharged. I was ready to go home by then. And moving to this regular ward from ICU was also helpful because now, now that I am able to get down, now I was able to do both the legs myself. I still couldn't scoot, it was hurting immensely. Any cough or sneeze was super painful in your abdomen. Um, they suggested that I hug a pillow when I do cough, when I have to, sneeze or something, but it hurt like hell. And So day four, when I got discharged, I ensured I had a pillow to hug, to put the seat belt on, so I don't directly put it on myself. And I was given all these, abdominal binders and whatever the necessary, things I need to go home. And yeah, came home. The first few days at home was a bit harder. I was still actually independent in going to, use the restroom or help myself into, changing, but I still needed help in draining. So one of the things that we have to do is the drains need to be emptied every 12 hours, and we have to log how much of the liquid is accumulated in each of these drains. We were given some boxes, that had measurements in ounce and cc when we came home, and my husband helped me with that. So we measured and logged. Um, I believe if the liquid segregation is constant above 20 cc, like in 30 or something, it has to stay on. But once it reduces, then that's when the surgeons would remove the um, drains. Um, I don't know what I was saying. It might have cut. So when if the liquid is still segregating at a level of 30 cc, the drains would remain in the body. But once it reduces the segregation to below 20, then they remove the drains. So I came home with three drains. So my first post-operative appointment was the next week of surgery, like 10 days after surgery. So when I went in, then the two drains came off. In that, I still had one drain remaining in that, and I had to wait one more week beyond that to get that removed. But at home, what are some difficulties where, like, not like going near any table or counter and pull your drain? You have to be cautious of that. But if you are wearing a top like me, where the drains are inside and the wires are not visible outside, maybe that might help a little. And definitely be cautious. I was able to take shower myself. Of course, I had my husband around in case I needed help or fall down. But um, I had a small thing to sit on when I took shower, but I didn't even needed it second time onwards. It was easy. I think the nighttime sleep is a bit hard because you are wearing abdominal binder, and if you have to get down, I couldn't get down by myself. I had to wake my husband to um, help me get up from the position, leaning position, to sit and get down. That was an inconvenience, and I found that the recliner for me was not the right setup, so I reclined my bed and stayed in my bed itself. But the sleep can be hard because you can't turn to your right or left. Of course, not even go on your stomach for a long time. So that is a bit of inconvenience, but doable. I would say this: every day gets better. One thing they encourage is to walk, to avoid blood clots, to help with the inflammation, and healing. And I am walking now, day 15, 8,000 steps within my house. Of course, it is flat surface, nothing like, challenging or incline or whatever, but, and nothing. I'm just taking my protein intake, the Juven drink that I talked to you about, and just one aspirin. I'm off of pain medication right when I got discharged. It doesn't. It does pain sometimes, like you get like sharp pain or a sort of a burning pain, but those are all healing pain, I'm told, especially the nerve endings that were cut. When they heal, they make, give you those. So that's a natural process. We just have to bear. It's okay. It's bearable. you know so here I am on my day 15. My pathology results came, and I'm happy to say that I had good negative margin. Everything came out, nothing cancerous, and the skin and nipple that was sparred are good, and I get to keep it. So that's great news. It was sort of a relief. And one big discovery was that in the third area of calcification, where we found cancer, in that area, the post mastectomy pathology, they found that about 7.5 centimeters spread of cancerous cell growth. That's huge. And uh, and the fact that this 7.5 wide area didn't even show up in mammogram or in MRI was the scariest part. This appeared as like one punctate calcification, and they didn't even suspect that pattern, right? Unless I insisted for the biopsy, because I wanted to determine the next treatment. Otherwise, this would have gone under the bucket of unsuspicious calcification. And the fact is that there was so much hiding, and that's a scary part. Now I have to think about my contralateral breast, where I don't have any calcification at this point, but who knows? Things could be hiding, right? So I have to think about tamoxifen. Someday I'll make a video about what decision I made and how my journey is in tamoxifen, if I do choose to take it. But the 7.5 centimeter spread is another uh, proof that we made the right decision of mastectomy, because that's a very wide area. If I went with lumpectomy, I wouldn't have any breast left there anyway. So mastectomy was the right choice here. It is not something I did proactively, or I went an aggressive route and just handled it, but rather I made the right decision, guided by the data, guided by the test results and biopsy results, and recommendations from these various surgeons. So yep, I did it. At least 15 days. I'm still not out of the woods, a long way to recovery. I'm so praying for the remainder of journey to be uneventful as well. Yeah, I'll talk to you after my 8 weeks, how it has been and whatnot. But I hope you find this useful. um, I don't want anybody to be in the place of making any of these decisions in the ideal world, but if it so happens, at least I would want you to have this information, um, and hopefully my experience helps you in one way or the other. Thank you so much.